Well, surprise to start with. I was nominated by my director here at Sir Charles Gairdner Hospital with the support of Curtin University, and I was very surprised, and I did say to her, no, I'm not ready for this because I haven't got the huge track record that I know a lot of the professors have got. And she reassured me. She said, no, you are ready for this because I think I spend a lot of time working and engaging with nurses and making research accessible, and I think probably that's why I was nominated. So yes, I'm hopefully building that research track record that we need to do as researchers, but I think the award was a validation actually of the other work that I do, which is very much on the interpersonal level, engaging nurses in research. So yes, I was surprised. It certainly was a wonderful feeling to feel validated and to feel confident that, that what I'm doing is making a difference. So yeah, it was ultimately wonderful. The night was amazing, and I think the opportunity to go and celebrate nurses at the awards event was a very humbling experience. But also I was just so proud of my profession, and I think every nurse should have the opportunity to go along and hear what nurses are doing right across this state, because there is amazing work being done, and it was a real celebration of that. So if I had not won an award, it was still worth being nominated, just to be able to go along and experience that celebration of nurses in Western Australia. I certainly hadn't expected to win. I knew that I was one of 3 nominees, or 3 finalists actually, for the research category. There were also another 21 amazing nurses there, so I didn't expect to win. So I was quite shocked, and in fact I felt jet lagged for about 3 or 4 days, I think, just absorbing it. It was an amazing experience to be contacted by so many people after winning the award, and it was very validating, I think, to hear from people who appreciated what I've been doing. I think one of the really special communications that I had was an email from a nurse who I had been her clinical supervisor when she was an undergraduate some 8 or 9 years ago, and she emailed me and she congratulated me and just said, I still remember you, you made a difference for me, and this is what I'm doing now. And she's now a clinical nurse at one of the tertiary hospitals and looking at doing some research herself. So you know, that was an amazing experience to be validated. I think it was very important. Well, I think it was an acknowledgement of the importance of research in nursing, and so I think for having a researcher win the Nurse of the Year award was a real validation and acknowledgement of the importance of research to inform excellent nursing practice. And I think it's given me an opportunity to go and talk to people about the research that we're doing and about how research can inform excellent nursing practice and improve patient outcomes and family outcomes, and of course outcomes for the staff who care for patients as well. So I've had some wonderful opportunities. I've been invited to speak to nursing associations. I've been invited to be part of the WA Clinical Senate, so I'm having opportunities that I wouldn't have had otherwise to engage in the broader healthcare community in Western Australia, multidisciplinary, but also throughout nursing, and to get the word out about what we're doing as nurses, but also in the area of research. So yes, it was a shock, but has just brought some wonderful opportunities and a validation of the work that we're doing, and I'm